So friends, I'm Dr. Himanshu Kataria. I'm now officiating as a Director Arthroscopy and Sports Medicine at Venkateshwar Hospital. Arthroscopy is basically a technique. It's a keyhole surgery, something which is akin to laparoscopy, anything which uses a scope. So the essential purpose is when we say arthro simply means a joint, and a scope means you're trying to scope the joint, you're trying to get into a joint to actually see a three-dimensional kind of a vision, whether you're doing it for any joint in the body. The most commonly done procedures are actually arthroscopies of the knee, where we try and scope the knee, or arthroscopy of the shoulder, where we try and scope the shoulder, or it could be any other joint like elbow, wrist, or it could be the ankle. These days, with the concept of the keyhole surgeries and the minimally invasive surgeries, the arthroscope has become almost the backbone of most of the orthopedic procedures, and majority of the joint related problems now, including management of ligaments, soft tissues, joint preservations, these things are now available at our hospital through the use of these high-ended gadgets, whereby we actually insert an arthroscope into a joint. This arthroscope is connected to a light cable, and which is again connected to a camera console. So by means of that, we are able to see ourselves, all these images in a live three-dimensional vision on a TV screen camera. And once we are able to see, most of the time in those patients in which we are doing the lower limb surgeries like the knee and the ankle, since these surgeries are done under spinal anesthesia, we are able to show most of them to the patients while the surgery is going on. We are able to show them the preoperative tissue condition, and we are able to show them the post-operative tissue condition and how it is reconstructed, or how we have managed to do whatever partial excisions or any other things are required. The biggest advantage of these scopic surgeries is that you are able to get these people, these patients, these sports persons back to sports, back to their normal living at the earliest. Since these are keyhole surgeries, therefore the rehabilitation protocol is much faster, it is much more aggressive, and they're able to get back to their work much faster. So I think in a sense, the medical world is progressing very fast towards minimally invasive procedures, and particularly towards arthroscopy, involving now almost every other joint. We have arthroscopes which are slightly smaller in size, 2.7 mm, 1.8 mm, for the ankle, for the subtalar joint, for the wrist, and for the hip, for the knee, and for the shoulder, we use the larger arthroscopes. So I think it is time that this awareness should rise in as many people as possible, so that people can take the benefit of this new technology, which has come in a big way and has come as a big savior to sporting personalities as well as to the lay public.